Today on All for Babies, we explain what implantation bleeding is, how it differs from menstruation, and how long it can last. Let's get started. What is implantation bleeding? Implantation bleeding is a light bleeding that occurs when the fertilized egg attaches to the lining of the uterus. This usually happens 6 to 12 days after fertilization, before menstruation is expected. During this process, the egg embeds itself in the uterine lining, which can cause slight vaginal bleeding. Unlike menstruation, which results from the shedding of the unfertilized uterine lining, implantation bleeding is an early sign of pregnancy. It's a signal that the fertilized egg is getting ready to develop in the uterus. How does it differ from menstrual bleeding? Implantation bleeding and menstruation share some similarities, which can lead to confusion. Both may involve light bleeding and mild cramping. However, there are some key differences that can help you distinguish between them: quantity and duration. Implantation bleeding is usually much lighter than menstruation. It typically lasts only a couple of days, whereas typical menstruation lasts 3 to 7 days and tends to be heavier. Color. Implantation bleeding often has a pink or light brown color, whereas menstruation is typically bright red. Consistency. Implantation bleeding tends to be scantier and usually doesn't require the use of bulky menstrual products like tampons or pads. Timing. Implantation bleeding typically occurs before the expected date of menstruation, whereas menstruation occurs at the usual time in the menstrual cycle. How long does implantation bleeding last? Implantation bleeding is generally brief and lasts between 1 and 3 days. It can vary in intensity and may be so light that some women barely notice it. For others, it may be a bit more noticeable, but still considerably lighter than normal menstruation. It's important to note that not all women experience implantation bleeding. Some may have it very lightly or not notice it at all. If you're unsure whether you've experienced implantation bleeding or if you're pregnant, it's advisable to take a home pregnancy test or consult a healthcare professional. In conclusion, implantation bleeding is a normal and early event in pregnancy that occurs when the fertilized egg attaches to the lining of the uterus. Although it can be confused with menstruation due to some similarities in symptoms, such as light bleeding and mild cramping, there are key differences in quantity, color, and duration. If you have concerns about a possible pregnancy or implantation bleeding, it's important to seek the advice of a medical professional for proper assessment and guidance on your specific situation. See you in the next All for Babies video.